Hi, welcome to Aspen Valley Hospital's Medicine in the Mountains. I'm Jenny Dyke, and with me today is Christina King. Christina is the Executive Director for the Aspen Strong Foundation. Welcome, Christina.
Thank you. Thanks for having me.
Yeah, it's nice to have you on the show. So Aspen Strong Foundation is really related to mental health issues here in the Valley, so that's our topic for the day. So how long has the Aspen Strong Foundation been functional?
Been functional. That's a good question. We kind of originated a whole year this week, pretty much.
Yeah.
So it all started off as an idea to have an event, a hiking event, to support mental health awareness in the Valley and connect all the resources. So that spun into play around this time, and we started applying for permits for Smuggler Mountain and doing all that stuff. And then we wanted to support the Mental Health Fund that's at the Aspen Community Foundation, to which Lawrence Altman had started in 2011. So I approached Lawrence, and he and I came to thoughts that we really like to see this community connect better with all the mental health resources, but also for the consumers to be able to, or community members in this valley, to be able to know what resources are available and how to find them, and if there was financial efforts like the Mental Health Fund, how they can utilize that. So thus the Aspen Strong Foundation started, and we have our 501c3 as of July this past year. And we've been doing quite a bit since then.
All right.
So we're pretty stoked.
So you just started as an awareness kind of thing.
Yeah.
And I'm guessing probably after some tragedies in the community that people were reeling from, and then it's just blossomed.
Well, yeah, no, it's interesting that you say that. Just about the time that it started, we did have many suicides in the Valley. But the idea really came after my hike with Chris Klug's event. I hiked up Chris Klug's event that November before, and I've done it for the second time this year. What a great, it's just an amazing event where everybody gets together and they support this cause. And in my, where I was coming from, I felt like, wow, this is awesome what our community does. You know, I've been coming here for 15 years. I've been a part of the breast cancer races. I've been a part of so many organizations that support efforts such as these great foundations. And there isn't one to support mental health. And being a licensed professional counselor, and that being, you know, close to my heart, I felt like, how can we start this? How can I kind of get this community, you know, talking about an issue that really is something that we need to look at and be more aware of.
And now you're doing great work. Now I did want to, you said that you are a counselor.
Yes.
So that's your background. So you have some pretty good knowledge of mental health issues.
I'd like to say that, but we're always learning, right?
Yeah. and you have a private practice.
I do.
Yeah. In addition to what you do with the Aspen Strong Foundation.
Yes, I do.
So I just wanted to ask you, well, first of all, how long have you been here? How long have you lived in the community?
Well, I lived here back in 2005, 2006, but I suppose that doesn't count. So I've been here for the last year and a half officially. So around like 2013, summer of that time. So yeah.
All right. So I want to ask you about just your take on this community and the mental health issues, which have really been in the forefront. We've read a lot in the newspapers, and you know, we really have heard a lot about how our community seems to struggle, maybe more than people would expect it to.
Yeah. Well, I think there is this facade that Aspen is that utopia, you know, that Walden, right? And essentially, when your Walden becomes too comfortable, you have to recognize that. And you know, if you know the story of the Walden, then you kind of get what I'm talking about. And I don't know. I see it as my vision coming here in the beginning was that this, you know, I'm a city girl, and the city girl was kind of, you put your head down and you walk straight. And then you come to Aspen and everybody's like, hey and hi, and everybody's so friendly, and they're just, I could walk down the street and know 5 people, and I think that's why. And we're so close knit. It's a really beautiful thing. But yes, there is the mental health issue, so we don't really see that on the forefront.
And we do think it's paradise.
Yes.
But paradise also has all the problems that everybody experiences in life in general, no matter where they live.
No, exactly. So it's hard for people to recognize that we do have one of the highest suicide rates per capita in the world. And so if you mentioned that on the ski lift, people are like, what? And where does that come from? But to me, when you really look at it, I don't see it. I see why it's that way. Everybody, there isn't a day that I don't get a phone call saying, have a drink with me, come out to dinner. And, like back in Philadelphia where I lived there, I waited till Thursday, Friday, Saturday to enjoy my time with friends or family. And in this community, it's just, it's every night of the week, and it's really hard to say no sometimes because you want to hang out with your friends and you want to go get that drink. And maybe you're not as dedicated. There's all different philosophies as to why we have mental health issues here. But I think that sometimes we don't necessarily ask ourselves the questions that we need to ask. Are we doing well? Do we have a healthy support network? Just regular, everyday questions.
Are we in balance?
Yes, are we in balance?
With our social life and our work life. And I think it's easy for people to get out of whack in this community because economically, a lot of people work a lot.
Yeah.
And that's hard. Socially, recreationally, there's a lot of opportunities to get involved in things that are not healthy as well. Whether it's substance use or whatever it happens to be.
Yeah.
So now you said, that as a city girl, you find that people are so friendly here. You walk down the street and people you barely know or don't know at all will actually say hi and be friendly. But I was talking to another mental health professional sometime in the last couple of months, and she was saying to me, despite that, there are a lot of people that feel really isolated here. They're surrounded by friendly people, but they still feel alone. Do you find that?
I see that in my office all the time, that people are out every night of the week sometimes, not every night, but then I ask them who their core support network is. There's a difference between your social network and your support network. And I don't think that many people ask themselves what the difference is and who these people are in their life and what they mean to them. And I ask my clients all the time, find people in your life that are going to bring you to your goals or going to support you, getting to your goals or asking you, what are your goals? And if you don't have those people in your life, then there's going to be an issue.
Right, have healthy relationships in your life.
Exactly.
That will enhance your life. So what is Aspen Strong Foundation's relationship with some of the other mental health agencies in the community?
Well, we're in our beginning stages, so really it's about bringing awareness and supporting the Mental Health Fund is where it started off at. So we have a great relationship with the Aspen Community Foundation in that we work together to support that Mental Health Fund and to distribute it to those in the community that need it. And to bring awareness to that fund itself. So if anybody cannot afford treatment, their therapist can apply to the Mental Health Fund to receive subsidized care for them.
Oh, really?
So that's
nice.
from Aspen to Parachute.
I did not know that. Has that been in place for a while, or is that kind of new?
That's the fund that Lawrence started in 2011.
Wow.
And then...
Well, good for Lawrence Altman.
Yeah.
I mean, golly, what an incredibly generous and creative solution for people that need help but can't afford to get it.
Exactly, and if you ever met Lawrence, his heart is in the right place when it comes to that, and he just nonstop giving to that fund and to our community when it comes to mental health especially. So
I love that.
Yeah.
So let me ask you this, because I do referrals through the hospital. That's part of my job. I get calls from people that they need help getting connected with somebody for, it ranges from A to Z. So for someone who really did need to see a psychologist, a counselor, somebody in the mental health field, and they just said to me, and I don't have insurance, and I don't have the means to pay, huge amounts of money, would I refer them to the Aspen Strong Foundation or the Aspen Community Foundation, or?
So, and right now we're working together. Essentially, in order to receive the fund, you have to have a provider.
Okay. So that's where you start.
Yeah. So, and you can find a provider through our Aspen Strong Provider Directory. So that's how we're kind of working together. If you don't already have one, you can find a match. Well, it's still populating, but in time, we hope that you can find a match through our provider directory of what issues you're going through, age group, in where location along the valley, and find the right person that fits your needs, and then apply to that fund, and that fund will support and you.
The treatment that you need.
Yeah, exactly. So,
right.
We ask the consumers who are utilizing it to give in some sort of fashion, whether it's $5
Right.
or $40.
Sure.
Depends on their abilities. But we just ask people to be honest. And, the fund is there. And it's
All right.
a pretty awesome fund.
It really is.
Yeah.
Now, I've nosed around a little bit on your website.
Yeah.
And I found that to be pretty impressive too. So I'd like to actually take a look at your website.
Yeah.
And have you kind of walk us through what the features are and how they can be helpful to people.
Yeah, that sounds great. Okay.
And it's aspenstrong.org.
Yes.
Is that right?
aspenstrong.org. Mm-hmm.
Okay. All right. Got a nice look.
Thank you. So, this is
There we go.
This is our homepage. So, welcome to the Aspen Strong Foundation. And I am going to first take you to, I know I talked to you about the provider directory, but I'm going to first take you to a screening tool that we adopted through mentalhealthscreening.org, which is doing some fabulous work, and they have, a screening tool set up for us. So it asks you, how are you feeling, asks you to take a brief screening. Why should I take a screening? Well, it's a regular checkup. It's anonymous, it's fast, and it's something that you can take for yourself or for somebody else. Just to ask yourself simple questions to see, do I have an issue in this area or do I not have an issue? Am I clear? Do I just need to check into a little bit more than maybe I did before?
So people maybe just kind of going, boy, I used to love life, and now every day seems to be a struggle, and that might be someone who goes in and just kind of touches base. And
well, what we were talking a little bit before is that there are some people with clinical mental health issues, schizophrenia, clinical depression, bipolar. There's a range of them, right? But then, there's also just the everyday, person who just, whether it's because they experience a loss or something happened, that they become depressed, or they build up anxiety for some sort of reason, or they turn to alcohol and they just start drinking a little bit more than they used to. So you don't have to have a clinical mental health issue to be aware, to be conscious of mental well-being. And this is what the screening tool is kind of getting at, is just asking yourself simple questions. So let's...
But you could also go on and say, I'm not concerned about me. How typical is that?
Yeah.
It's not me.
Of course I don't want to ask questions about me.
But maybe seriously, somebody might be worried about someone they care about.
Absolutely.
And they're just trying to get a handle on...
A friend, a daughter, a husband,
Are my concerns legitimate or not? And so this would be a great way to kind of try to answer the questions as if that person might answer them.
Exactly. So just questions here, sort of ask demographics, and then how many drinks containing alcohol.
Okay, so this one is focused on alcohol use, right? But there's a lot of others. We'll check them out. But this one's really focused on alcohol. So
I'm just responding to these randomly.
So,
but
have you been injured?
Happens.
How often are you drinking? Has somebody else been concerned about you? Did you want to end your life?
And this is a question that comes up for all of them. And I really want to tell you, this is a pop-up, tells you the National Suicide Prevention line, but also brings you to our crisis page. And, we're really we're really lucky in this valley. We have 2 crisis units, 24/7, that respond to crisis. So we have the Aspen Hope Center here, and we have Mind Springs, and 2 great places to contact when you're in crisis. Then we have our faith-based crisis response, because some people want to reach out to their church, so Crossroads and Roy Holloway, and our statewide and our national crisis response. So I just really wanted to show everybody that page, because we are not a place that provides services, but we are giving the resources.
Okay.
So that's an
And
important resource.
I guess some people might feel more comfortable with a local agency.
Yes.
And some people may say, I don't want to talk to, I don't want to start with a local agency, and they'd feel more comfortable with the state or the national hotline.
Exactly.
So you just never know.
All the resources
Yeah.
are there, and they're essentially going to bring you to the right place.
Okay.
So this one, your responses are consistent. Ooh, so I have something that I need to be aware of, and I might be at risk for suicide. I can click on here, and there's some resources available to me about what alcohol use is, and all different things. But for sake of time, we'll bring you down to here. It also gives you the crisis information again, and then it brings you to our referral information. So, and our referral information is what I talked about earlier, brings us to our provider directory. So I'll click on that link. And so here we have, it asks you a simple question, what are issues I'm dealing with, or what have I been diagnosed with? And on the left-hand side, some treatment orientation or resource options or zip code that I can also look through. So let's just say...
So it's going to help you find someone close to where you live to make it convenient, and for, whatever it is you're concerned with.
Yeah.
So you just did, as you said, that random response to the one about alcohol use. So you could put in...
I could put in alcohol use and find who are my providers that that deal with addiction. Or maybe I have another issue, but I know I have alcohol, so I want to kind of work through both of them. Okay. And so I find that, and then I have a list of providers that pop up on the screen.
So you've got people that are in private practice, I can see there.
Yeah.
For sure. Okay.
So, and then when I click on a name, it kind of opens up and tells me a little bit more about them than just this front page. I'm hoping this one pops up right now. So here we go. Yeah, so there's Mary Boyles. She is down in Glenwood. There's her phone number. I'm sorry, Newcastle. And tells you some specialties, her payment methods. She does not accept insurance, but there is an option for that on the website. Modality and client focus. So it just gives you a little bit more information about these people, and you can go to our website, but and all of them, you can go to their website or their Facebook page, whatever they have linked up there. To me, this was an effort in my own search for finding a therapist, is that I had a list of names from my insurance company, and I was like, I don't know what they look like. I don't know who they are. Are they old? Are they young? Are they... I wanted to know. And so I started Googling, and half the people came up on a Psychology Today website, and half of them came up in a Health Network something website, and some of them didn't come up at all. And to me, I felt like that really kind of made me hesitate on who I should call and how to get help. And in this valley where we're trying to empower people to get help, whether they really do have a clinical issue or they just need to talk to somebody, they just need to use an EAP, or they just need one session to just say, having some difficulties communicating with my husband, can you give me some tools? And I want to decrease that hesitation. And so we developed this website, the Aspen Strong Foundation developed this website to just allow the community to know whether you're a primary care doctor, another physician, another therapist, or just a community member, where the resources are, who is there, and how can I get that help as fast as possible.
And you get a little information about that person, because really, I mean, it's like connecting with any other, with a physician.
Yeah.
They can have all kinds of great training, but you gotta have some other connection and rapport. So this is a great starting point.
It is. It is to me, I feel like it's a great starting point. It put something in place that I felt that would have helped me. And I'm thinking if just even one other person experienced the same thing, which I know that they have,
Sure.
then this is a place that they can go to. And it's not just for individual providers, but the Aspen Hope Center, Mind Springs Youth Center, in time I hope to populate it with all the resources in this valley so we just know what's available, what's there, and what's missing, so that in time, maybe when the Aspen Strong Foundation becomes financially able, that we can start pushing and creating resources that we don't have already. And just last on our website is a calendar. So either you want to find a support group, or you want to know about Light It Up Blue, which is supporting autism at the Jerome next Sunday. So there's all event information in here, or support group information about where to, if you need to go to an AA group and you're down in Rifle and you live in Aspen, well, where are they? And you could just go right to our website and it'll tell you exactly where they are, location, phone number, whatever it is.
So I guess when someone is thinking that they might need help, the last thing you want to happen is for them to be ready to find that help and just go, but I don't know where to turn.
Yeah.
And so this really makes that part of the decision to get some help easy.
Yes.
Because it's all right there. You made an interesting comment too. You were saying, sometimes it's not like people are struggling with some absolutely catastrophic mental health issue. It's not like they have a diagnosis per se from the mental illness diagnosis book. I can't remember what you call it. I know there's one out there for you guys.
The DSM.
Yeah, exactly. But a lot of times people are they're just struggling with getting through life.
Yeah.
And there's nothing wrong with asking for help.
Yeah, and sometimes, in this community where you talked about earlier, we work a lot. I have 3 jobs. The first time I lived here in 2005, I don't know how many jobs I had. And it's just it's an expensive town, but it's a really great, empowering town. But we all want to be a part of it. So sometimes we just get in that financial glitch. And then if we don't recognize it, where does that turn into? And when are we going to reach out for help? And it's okay to reach out for help. I think I shared with you earlier, I had 2 phone calls to my practice from Triad, from the Ski Co. Employee Assistance Program this past week. And the one person sat in my office and I said, well, what is your expectation? Do you want to just use these 3 sessions? Are we going to go further? And she goes, well, I'm not sure yet, but I just feel like I should use my sessions because everybody should talk to somebody. And I felt like I was like, can I record you? Because you're right. You just, mental health should just be looked at as physical health. I have a friend back home. She has cystic fibrosis. And her and her sister both have it. They're in the hospital 3 times a year. And that's a serious physical health condition. I don't have that. But that doesn't mean I don't go to the doctor and have checkups. That doesn't mean when I have a knee pain that I don't go to a knee specialist. And so mental health should just be looked at the same way. As I may not have a clinical disorder or something that's recognized essentially in the DSM. But if I have an issue that I need help with, there's no shame in asking for help. And we have a huge community that supports it. And we have just, asked all the resources that are coming together. And, small story, I met with somebody who wanted to volunteer for the Aspen Strong Foundation recently. And we sat down, we had a cup of coffee. And she told me this, really powerful story of the past year, 2 years, of her helping her daughter through a mental illness. And then this woman herself having some issues. And she recognized Aspen Hope Center, Aspen Valley Hospital, Mind Springs, Response, and one other, I can't think of it right now, of all people who stepped up to the plate to support her and her family. And I was like, wow, this is what 2015 is all about. It's about us connecting and, working as a team to help people like this.
I love that you told that story because I know for me at the hospital, of course, we have people that come in that are typically in crisis when we see them. And boy, do we count on other people that are really experts in the mental health field to help us manage those patients and find the best way to get help for them,
Yeah.
to get treatment for them. And for me personally, in my role, it's really nice to have learned more about the Aspen Strong Foundation and how I can help people just when they call for a referral. And
Yeah.
usually it's not for themselves.
Yeah.
It's for someone they know, and they just don't know where to turn. And now I know a lot more about where to get people connected.
And it's great. It's anonymous. You can open it up on your phone or your laptop.
Right.
It's not a center that you have to go to.
Yeah.
And it's always great to have a center to go to. But it's nice to have the resources in one place. And
Yeah.
it's really cool.
Well, it's just one more way I think that this community has come together with expertise and with financial generosity
Yeah.
and, people just caring
Yeah.
about other people in this community to try to make us as healthy as we can possibly be. And what better goal could we have?
I know, right?
Now, how will you
pretty
know, when
fascinating.
will you say Aspen Strong Foundation is a success? Will you ever get there? Will you know that?
I think I already feel it because
Okay.
I think, we talk about sustainability over time, but I had this conversation with somebody last year, Susan Morrison, and she and I talked about, like, what are my efforts in Aspen Strong? What are we doing? And she said, it doesn't matter if you end tomorrow or if you're here for years, you already made a difference. And that's how I know that it's already a success,
Right.
just
Very
being a
nice.
part of making a difference is a success.
All right.
So thank you for asking that.
Thanks.
Thanks for having me.
Yeah, thank you for being here. And,
Yeah.
I just want to say to people in the community is, as you talk to mental health professionals, whether it's somebody with Aspen Strong or Mind Springs or the Hope Center or wherever it happens to be, whether it's somebody like Lawrence Altman, who's, really taken a leadership role, boy, we should all be saying thanks to those people for helping to make our community a better place to live. And thank you for joining us. I'm Jenny Dyke. This is Aspen Valley Hospital's Medicine in the Mountains. I've been speaking with Christina King from the Aspen Strong Foundation. AspenStrong.org is their great website. And what's the phone number if somebody wanted to call?
970-300-5197.
Okay,
Yeah.
great. Thanks so much for joining us. We'll see you next time. Bye-bye.